Botflies belong to the Oestridae family, and their larvae infest mammals, becoming internal parasites which grow inside the flesh of their hosts. The word bot is commonly used to describe the maggot that keeps growing, and which, if buried deep enough, has the potential of causing serious damage. Known as Dermatobia hominis by its scientific name, the human botfly is among the few fly species, the larvae of which parasitize humans. Their eggs are vectored by more than 40 species of muscoid flies and mosquitoes, and also by a particular species of tick. A disease vector is a term used in epidemiology to describe the agent, whether it is a microorganism or an animal, that is responsible for carrying and transmitting the infection to another living organism. After capturing a mosquito, the female botfly attaches its egg to the mosquito's body. After the eggs are placed, the mosquito is released. At this point, there are two ways in which the larvae can enter the human body. Once the mosquito starts feeding, the eggs might hatch, at which point the larvae use the bite area to enter the human body. Another infection possibility is for the eggs to simply fall off the vectoring agent's body as it lands on the human skin. Afterwards, it starts to grow inside the subcutaneous skin layers, and in approximately 8 weeks' time, they begin to pupate, meaning that they enter the intermediate stage between larva and adult. An adult human botfly bears a resemblance to the bumblebee, having a similar body with a stout, round build covered in soft hairs. Their lengths vary, typically between 12 and 18 millimeters. Their large compound eyes and the fact that they lack a mouth part are among the features which make them easy to recognize. Number 4. Alan Evans. Alan Evans awoke with excruciating pain in his leg days after visiting Gambia in May 2008. The 50-year-old had been bitten several times by mosquitoes during his 2-week-long holiday, but did not notice anything unusual at the time. After he came back, Evans was feeling weak, like something was draining his energy out. The holidaymaker also felt like somebody was stabbing him in the leg with a dagger. Initially, the doctors diagnosed him with a tropical infection and prescribed him antibiotics. The 50-year-old went home and began the treatment, but days later, the so-called infection got worse. He looked at his mosquito bites and was petrified to notice that something was moving under his skin. Evans poked the wound and it bounced back. He bought a magnifying glass to analyze the bite and was terrified when he saw what he thought was a crab's claw. At that moment, he decided to go back to the hospital. The hospital consultant discovered the man was suffering from a rare disease called myiasis, caused by parasitic larvae, commonly called maggots. The doctors managed to squeeze 2 of them out of the wounds and had the other 4 cut out. After clearing out Evans' bites, the doctors told him that botfly eggs had been deposited into his leg by mosquitoes. The maggots could have developed into flies, as the larvae were burrowed very deep under his skin. Even though there have been reports detailing the presence of human botflies in certain regions of the European continent, the main concentration of the species is in the Americas. They generally prefer moist, hilly habitats and secondary forests. Human botflies may be found in areas ranging from the south of Mexico to the north of Argentina, Uruguay, and Chile. Number 3. Brian Williams and Ali Vag. Ali Vag and her boyfriend Brian Williams were enjoying a trip to the Amazon basin in January 2013. The Australian couple was vacationing in Bolivia when they both felt slight irritations on their skin. They did not pay attention to any symptoms, as they thought they were experiencing itchiness from the mosquito bites. However, days later, Vag and Williams both felt something squirming under their skin. They watched in horror, as at times, larvae were poking their heads out of some of the open wounds. They rushed to a local hospital where they were diagnosed with human botfly infections. The maggots were feeding on their flesh and would occasionally come to the surface. In an attempt to starve the larvae of air, Williams spent a couple of days with tape over the wounds on his stomach. He even had a friend pull 3 of the maggots out in a stomach-churning scene that made both Williams and his friend nearly throw up. After receiving medication for the wounds, the couple remained stranded in Bolivia for more than a month, as they were not allowed to leave the country until their infections cleared out. Ali Vag and Brian Williams were able to return home in late February when they were fully healed. One of the most common consequences of Dermatobia hominis infestation is the development of an affliction called myiasis. The larvae may parasitize various areas of the human body. Their entry points may be unbroken skin, open wounds or lesions, the nose, or the ears. If they are swallowed, gastric or internal myiasis becomes a possible occurrence. The types of myiasis vary depending on the part of the body that is infested. The most common form of this affliction, developed upon human botfly infestation, is cutaneous myiasis, which manifests itself through furuncles or ulcers, which appear as swollen regions on the patient's body. Other types include nasal myiasis, which can cause fever, facial edema, severe irritation, and obstruction of the nasal passages, myiasis of the human eye or ophthalmomyiasis, which can cause retinal detachment or glaucoma, and oral myiasis, which, if located in the middle ear, has the danger of larvae reaching the brain. The maggots feed on the tissue of their host. There have been cases in which the larvae had reached the brains of infants through gaps called the fontanelles of the infant's cranium, which had not fully developed yet. In these cases, as the maggots burrow their way through the tissue layers, their host may experience severe pain and tissue damage. Fatalities have resulted in rare cases due to cerebral myiasis. The lesions and damage caused by the maggots burrowing may lead to additional infection, which, if left untreated, may result in further health problems and even death. The larvae have spines on their tegument, which enable them to anchor themselves in the flesh of their host, and thus removing them is a procedure that must be executed carefully. Severe infection is likely to occur if larvae removal is not done properly, and parts of it are still present inside the human body. The maggots keep eating through the tissue, and as they grow in size, patients have commonly described being able to see and feel them squirming underneath their skin. Death is a possible scenario, even though the number of fatalities caused by human botflies is hard to determine, as most infestations occur in remote or impoverished areas where a proper medical analysis is difficult to perform. Number 2. Arendalis. When the doctors first examined the strange swollen area on Arendalis's head, they had several theories. One of them was that he had been bitten by a gnat, while another entertained the possibilities that he had contracted shingles, a painful skin rash brought about by the varicella zoster virus. The doctors were shocked when they saw the bumps starting to move. They soon discovered that the man had 5 botfly larvae living inside the skin near the top of his skull. Arendalis told a media outlet, "I'd put my hand back there and feel them moving. I thought it was blood coursing through my head. I could hear them. I actually thought I was going crazy. It was weird and traumatic. I would get this pain that would drop me to my knees." Dallas had recently been on a trip to Belize. The medical specialists believed that he contracted the infestation at some point during his trip, and that it had occurred via mosquito bites. The parasites were eventually removed from a pit that was between 2 and 3 millimeters wide, and Dallas made a full recovery. The best course of action in dealing with a botfly infestation is contacting a medical professional in order to have the larva removed. For many of those unfamiliar with the issue, seeing the maggots starting to squirm under the skin can often cause panic, which would lead to an immediate attempt to remove it. If it is not executed properly and the larvae is not removed in its entirety, the attempt may leave the patient vulnerable to a secondary infection, which may prove to be a greater health risk if not treated with antibiotics. Even though the idea of a human botfly infestation may sound like a gruesome scenario, the fact that the larvae still needs to breathe through a surface point offers several treatment options. Applying petroleum jelly over the entry point surface will cut off the larvae's air supply, suffocating it. After around 24 hours, the larvae can then be removed using a pair of tweezers. Using a mixture of white glue and safe insecticide on the swollen area also has the potential of killing the larvae. As it still needs an air hole to breathe, the maggot will eat through the glue and die in the process. First aid kits usually come equipped with venom extractor syringes, which can be used to remove the larvae easily at any stage of their growth. There has been at least one instance in which applying nail polish to the area has resulted in the larva's partial asphyxiation. Some have used adhesive tape as a method of suffocating the larvae. This, however, is not advised, as the larva's breathing tube is fragile. Upon the tape's removal, the tube might break off, which would leave most of the larva's body behind. In case the maggot is located in an area that makes invasive treatments difficult, the use of ivermectin, an antiparasitic drug, has proven effective. Number 1. Piotr Naskreki. Most people would dread the very idea of a botfly infection. However, Piotr Naskraki, an entomologist from the Harvard University in the United States, allowed 2 human botfly larvae to grow inside his skin for scientific purposes. After he had returned from a trip to Belize, Naskraki noticed that the mosquito bites he had contracted during his trip were not healing. He soon realized that he had botfly larvae living inside his skin. He had one of the larvae removed with a suction device, but then decided to commence an experiment in which he let 2 of them eat away at his flesh and keep growing inside his skin. For 2 months, the larvae continued to increase in size until they were big enough to crawl out. The entomologist made a video documenting the experiment and showing the moment in which the maggots emerged from his skin. In the video, Piotr Naskraki said, "I figured that being a male, it was my only chance to produce another living, breathing being out of my flesh and blood." 6-year-old Dunya Sibomana, his 4-year-old brother, and one of their friends were playing near a river close to Virunga National Park in the Democratic Republic of Congo. Tragedy struck when the boys were attacked by a troop of chimpanzees. It was believed that because of the poaching and violence inside the park, the chimps viewed humans as enemies intruding on their territory.